Imagine standing at the edge of a vast ocean, feeling both awe and fear as the waves crash relentlessly before you. Life often places us in moments that feel just like this. Moments where uncertainty looms and the path ahead seems unclear. For those living with chronic kidney disease, the thought of undergoing surgery can feel like facing that ocean, daunting and fraught with risk. Yet within this fear lies an opportunity, a chance to awaken a deeper understanding of our resilience, our preparation, and our ability to embrace the unknown with courage. Surgery, by its very nature, demands careful planning, especially for patients whose kidneys have already endured the relentless burdens of disease. The challenge is not simply the operation itself, but the delicate dance of balancing fluids, medications, and anesthesia, all while protecting the fragile life-sustaining organs that quietly work every day without asking for acknowledgement. Every step, every decision, every consultation matters profoundly, and this is where knowledge becomes power. The wisdom of experts, the guidance of experienced hands, and the teachings of pioneers like Dr. Mathew R. Weir illuminate the path, reminding us that preparation is not just a medical protocol, it is a declaration of intent, a conscious choice to honor life and take control of the elements within our reach. In this space between fear and action, patients discover the transformative power of awareness, the quiet courage in asking questions, and the determination to transform vulnerability into strength. The journey towards surgery, when approached with intention and understanding, becomes more than a medical procedure. It becomes a metaphor for life itself. Moments of uncertainty, approached with knowledge, mindfulness, and hope, can be transformed into opportunities for growth and empowerment. To navigate this path, one must learn to listen to one's body, to the advice of healthcare professionals, and to the silent voice of intuition that often knows what is necessary before the mind fully grasps it. Every precaution taken, every plan made, and every question asked is a step toward reclaiming control in circumstances that may initially feel uncontrollable. It is here, in these deliberate acts of preparation, that the teachings of Dr. Mathew R. Weir resonate most deeply, guiding individuals to approach their health with both wisdom and courage. Each patient's journey is unique, yet the principles remain universal. Awareness, preparation, and conscious engagement with one's circumstances can profoundly influence outcomes. Surgery for CKD patients is not just about addressing a physical condition. It is about nurturing the mind, preparing the spirit, and cultivating resilience that will echo long after the procedure is complete. In these moments of anticipation, when doubts arise and the weight of uncertainty presses heavily, one must remember that clarity comes not only from medical expertise, but from the intentional acts of care one practices every day leading up to the surgery. Nutrition, hydration, medication adherence, and emotional readiness are all integral threads woven into the tapestry of recovery. By embracing these responsibilities, patients transform fear into proactive action, uncertainty into informed decision-making, and anxiety into meaningful engagement with their health journey. This approach does not guarantee a life free from challenges, but it illuminates a path where fear no longer dictates action, and hope becomes a guiding principle. The ocean before you may be vast, unpredictable, and at times overwhelming, yet with careful preparation, support, and insight, drawn from experts like Dr. Mathew R. Weir, even the most formidable waves can be navigated with grace and determination. This moment, standing on the precipice of change, is not merely a trial. It is an invitation to rise above doubt, to embrace resilience, and to transform the experience into a testament of human strength, awareness, and perseverance. As the day of surgery approaches, a shadow of uncertainty inevitably falls upon the mind, whispering questions that cannot be ignored. What if complications arise? What if the fragile balance of my body tips unexpectedly? These thoughts are not signs of weakness. They are reminders of the profound responsibility we bear for our own health. Chronic kidney disease adds layers of complexity to every medical decision, where even a minor misstep can ripple into consequences beyond immediate comprehension. The suspense of what lies ahead is almost tangible, And yet, it is precisely within this tension that clarity and preparation reveal their true power. Understanding the interplay between anesthesia, fluid regulation, and medication is not merely a technical requirement. It is an intimate dialogue with life itself, a conversation about survival, resilience, and the value of deliberate, informed action. Patients often imagine the unknown as a dark corridor, where each turn might conceal hidden risks, and the anticipation can feel paralyzing. But here lies the paradox. The very act of preparing for the unexpected transforms fear into mastery, doubt into deliberate strategy, and anxiety into a grounded awareness that empowers rather than debilitates. This is where the guidance of experts and the profound insights shared by pioneers like Dr. Mathew R. Weir become essential beacons. His teachings remind us that vigilance, mindfulness, and a deep respect for the body's complexity are not just procedural necessities. They are philosophical approaches to life, a way of confronting uncertainty with courage and foresight. Each precaution, from carefully timed medications to meticulous monitoring of fluid intake, is a statement of intentionality, an assertion that while we may not control every outcome, we can influence the trajectory of our own recovery. The suspense of surgery is both literal and metaphorical. It mirrors the tension we face in life whenever stakes are high and the unknown looms large. And just as life's greatest lessons often emerge from moments of challenge, so too can the experience of surgery, approached with awareness and preparation, become a profound teacher of resilience, patience, and self-knowledge. Within the silent hours before an operation, when the world seems to hold its breath, patients discover that preparation is not only physical, but deeply spiritual. The mind, when guided with intention, becomes a tool as vital as the most advanced medical instruments. One begins to see that every choice matters. Every meal, every hydration, every moment spent in reflection or dialogue with healthcare providers builds a foundation of security and strength. The suspense of uncertainty is softened by the recognition that knowledge and preparation are powerful allies, and that even in the face of risk, one can cultivate calm, focus, and determination. Dr. Mathew R. Weir teaches that awareness of the smallest details, the timing of medications, the response to stress, the careful evaluation of lab results, can dramatically influence outcomes, transforming what might seem like a perilous path into one navigable with precision and confidence. The tension in this period is like the pause before a storm breaks. It is heavy, palpable, and filled with questions that demand attention. Yet it is also the crucible in which strength is forged, where patients learn the importance of patience, the virtue of preparation, and the quiet courage that comes from confronting uncertainty head-on. Every moment spent planning, questioning, and understanding the intricate interplay of body and treatment serves as a shield against the unpredictable, a way to assert agency in situations that may feel overwhelming. Suspense, then, is not the enemy. It is a reminder of the stakes, a signal that careful attention and deliberate action are required, and a call to embrace resilience. In facing the unknown of surgery, patients are offered a mirror into their own capacity for courage, insight, and proactive engagement. The lesson is clear. The uncertainty that once seemed terrifying can be transformed into a source of motivation, clarity, and empowerment. Each precaution taken, each consultation attended, and each moment of reflection becomes a testament to the human spirit's ability to navigate challenges with awareness, patience, and hope. And through it all, the teachings of Dr. Mathew R. Weir resonate deeply, reinforcing that life's most significant journeys, whether through illness, surgery, or personal transformation, demand both respect for the unknown and the courage to act wisely within it. In the wake of uncertainty, after acknowledging fear and preparing for the unknown, comes a profound opportunity for empowerment, where knowledge, patience, and intention converge to illuminate the path forward. For patients with chronic kidney disease, approaching surgery with deliberate care transforms a potentially daunting experience into a journey of self-mastery and resilience. The preparation that begins weeks or even months before the procedure, monitoring lab results, adhering to prescribed medications, optimizing nutrition, maintaining hydration, and cultivating emotional readiness becomes a tangible expression of agency in a world where so much feels unpredictable. These steps, guided by insights inspired by Dr. Mathew R. Weir, are not merely clinical instructions. They are profound acts of self-respect, reminders that every individual possesses the capacity to influence outcomes through conscientious action. Each consultation with a healthcare provider, every thoughtful question asked, and every precautionary measure taken serves to reduce risk and fortify confidence. This preparation is not an abstract exercise. It is the cornerstone of both physical and mental resilience. Beyond the tangible actions, there exists the deeper, philosophical dimension. The recognition that uncertainty is an integral part of life, and that mastery is not the elimination of risk, but the conscious engagement with it. Surgery becomes more than a medical event. It becomes a metaphor for life's larger challenges, teaching us that courage is cultivated not in the absence of fear, but in the deliberate choice to act wisely despite it. Patients learn that control is not about commanding every outcome, but about taking responsibility for the elements within one's reach, honoring the body's needs, and aligning actions with informed guidance. When these principles are embraced, even the most complex surgical procedures can be approached with clarity, dignity, and hope. The human spirit, when combined with knowledge and preparation, reveals a remarkable capacity to endure, adapt, and flourish. Practical strategies, such as meticulous monitoring of fluid balance, careful scheduling of medications, understanding the effects of anesthesia, and maintaining a supportive environment, are critical tools in this journey. Yet equally important is the cultivation of mindset. Patience, persistence, and self-compassion become allies that guide the patient through moments of doubt, discomfort, or anxiety. The teachings of Dr. Mathew R. Weir remind us that true preparation is holistic, blending science with mindfulness, action with reflection, and knowledge with self-awareness. In recognizing the interconnectedness of body, mind, and spirit, patients discover that every small step contributes to a larger trajectory of health and recovery. There is profound empowerment in knowing that the steps taken today, planning meals, following medication protocols, engaging in gentle exercise, or practicing calm breathing, have the power to shape tomorrow's outcome. This perspective transforms surgery from a source of dread into an opportunity for active engagement and personal growth. Even as challenges arise, hope persists, because preparation has laid a foundation of strength that cannot easily be shaken. Patients come to understand that while they cannot dictate every variable, they can influence the factors within their control, crafting an environment where recovery is supported, complications are minimized, and confidence is nurtured. Ultimately, the journey through surgery for CKD patients is a testament to human resilience, an illustration of how knowledge, intention, and careful action combine to create outcomes that are both safer and more empowering. By embracing preparation, patients transcend passive fear and step into an active role, guided by insights and wisdom inspired by Dr. Mathew R. Weir and supported by their own dedication and courage. In this process, every precaution is a statement of agency, every informed decision a demonstration of self-respect, and every moment of mindfulness a reinforcement of hope. Life's uncertainties, when faced with preparation and intention, no longer dominate, but become catalysts for growth, resilience, and confidence. Surgery is not merely a medical procedure. It is a profound exercise in patience, awareness, and the conscious cultivation of personal strength. And as each patient emerges from the experience, they carry more than the physical healing of the body. They carry the enduring lesson that preparation, courage, and intentional action can transform fear into mastery and uncertainty into opportunity. If you are benefiting from our topics, please subscribe, like, and turn on the bell notification so you can see our new videos early.